Hello, I'm Rosalynn Stahl. The topic I will be debating is should frontline healthcare workers receive hazardous pay during a pandemic? I'm sure by now everyone has heard of COVID-19. And if you have heard of this, then I'm sure you have some general information on how this has affected healthcare. There are shortages of personal protective equipment or PPE, and many healthcare workers have also contracted this virus. Healthcare workers are in general exhausted from this pandemic. I especially want to recognize the healthcare workers in New York City and some of those other hot areas. I certainly appreciate their services and my thoughts and prayers go out to them. As this pandemic has unfolded, there has been some discussion about frontline healthcare workers receiving hazardous pay. This is the topic that I will be arguing against. And before you think that this presenter is narrow-minded and is inconsiderate of healthcare workers, I have the right to argue this subject because I am also a nurse. So to make a beginning, we are going to go back to 1854 during the Crimean War. During this time, a young lady named Florence Nightingale and her team went to a British hospital in Scutari, Turkey to help care for the sick and wounded soldiers. They found the conditions there horrible. Medicines were in short supply, hygiene was being neglected, and mass infections were common. Many of them were fatal. Under the care of Nightingale, death rates sharply decreased. Florence Nightingale became the founder of modern nursing. I want to point out here that reimbursement meant nothing to this lady who founded nursing. She is our founder. She is our role model. Our duty is to care for our patients under all circumstances, from the Crimean War in the mid-1800s to COVID-19 in 2020. So let's fast forward to the 1860s during the beginning of the American Civil War and take a look at Clara Barton. Clara Barton set up makeshift hospitals and cared for the wounded and dying soldiers. She became known as the Angel of the Battlefield. After the war, Barton founded the American Red Cross. Again, here is a lady that reimbursement meant nothing. Again, our duty is to care for our patients under all circumstances, whether that is the Crimean War, the American Civil War in the 1800s, or to COVID-19 in 2020. If ladies such as Florence Nightingale and Clara Barton demanded a better reimbursement, or as we call it today, hazardous pay, for their care, many soldiers may have been neglected of the needed care. Without their commitment to serve others, we may not have the nursing foundation that we have today or the American Red Cross. Your argument to these last examples may be that these ladies did not risk their own health and lives by caring for these soldiers as the healthcare workers are today, working the front lines caring for patients with COVID-19. And I agree with this statement. But I also want to point out that there are other professions today who go to work daily and risk their lives. We will look at those next. So what about these guys and gals? With each traffic stop and each criminal investigation, this group risks their lives. Should they get hazardous pay, and what amount should that be? The average annual salary for nurses in Indiana, according to ZipRecruiter, is $64,689. The average police officer salary in Indiana, according to ZipRecruiter, is $44,615 a year. So at a baseline pay, nurses are already being paid more money. Imagine the pay difference if they still received hazardous pay. It does not seem reasonable that a police officer who risks his life daily makes a significant amount of money less than what the nurse does at a baseline pay. And what about all the other essential workers who may be at risk? There is a large group of other essential workers who could come in contact with COVID-19 each time they go to work. Retail workers, linemen, restaurant workers, environmental service workers, farmers, and truck drivers are only just a few that I will mention. Sadly, some of them are only being paid minimum wage. Should they also get hazardous pay right now? And it would not be appropriate to only pay one profession hazardous pay during a pandemic. A lineman may say that he should get hazardous pay after a bad storm when there are line poles down across a large area. This is very hazardous work to get those back up and functioning properly. A truck driver may also say that he needs hazardous pay while driving on snowy and icy roads. The supplies need to be delivered, and they are putting their lives at risk by being on the road. So back to the beginning question, should frontline healthcare workers receive hazardous pay during a pandemic? Considering that most professions have a moment during their career that is considered hazardous, the answer is no. We understand when we decide what career path to pursue that there will be bumps along the way. COVID-19 is the bump in healthcare today. We must all work together to get through this. One essential profession is not any more important right now than the other essential profession. We are all in this together. Thank you for taking the time to listen to my presentation. This is the list of my resources.